Welcome to the review lecture for Chapter 21 from the ISHM Edition 8 textbook. Chapter 21, The Role of Information Technology in Central Service. Okay, so information technology, we're talking about computers. Computers are an increasing vital component in all industry. Healthcare is no exception. In healthcare, there are computers being used for such things as clinical patient registration, electronic medical records, order entry, operational, including email, supply chain management, asset management, financial, and public relations, even Facebook accounts. This is information technology. So, information technology is increasing in use, and CS staff are learning to use it. We use information technology to ensure that we can quickly locate items, to determine when consumable supplies should be replaced, to monitor item usage, to maintain accurate records of processes such as sterilization and distribution, to assist with quality assurance processes and regulatory compliance, and to capture information for financial analysis. All of these things were possible when we had clipboards and binders full of paper and using pens. However, it's so much more efficient now because computers can do things humans can't. And humans can do things computers can't. Humans can forget things, lose binders, lose pieces of paper. So, computers are better at storing and retrieving data. Often, information technology is the cornerstone of initiatives to transform healthcare. Excuse me I don't want to keep stopping and starting the video over again, so I'm going to leave in all the little slips of the tongue. Information technology is often the cornerstone of initiatives to transform healthcare. Most CS departments do use some form of automated information management system to track products and document processes. Not all, but most. There are some smaller clinics or smaller hospitals that haven't yet made the jump to using computers, but they're growing smaller in number. Our core mission is to support patient safety and quality patient care. So information systems can be used to ensure that these objectives are accomplished. So back to the different various types of systems. Clinical information systems. These are at the heart of the core mission of the healthcare provider. That's the doctor and nurse. They can do things like access and modify patient healthcare records. They can be used to register patients. The ADT system, or admissions, discharge, and transfer system, is used to manage inpatient and outpatient registration. How this is important to CS techs is because we can get information from the ADT system involving patient census. But we don't have access directly to the ADT system. We don't need it. We do need access to our emails. You'll be getting an email assigned to you if you're working for a company such as Banner or Dignity Health. Supply chain management, which is mostly something used by materials management. Supply chain management is tracking things, cast padding, rolls of toilet paper, wraps, boxes of indicators, things like that. That's the supply chain. CS techs that are working in a hospital that has a tracking system are using an asset management system. We can use an asset management system to track the movement throughout the facility of instrument sets, patient care equipment. That's my cat meowing over there. Okay, so a supply chain management system is an MMIS, Materials Management Information System. That's used for managing purchasing, receipt, and inventory control functions within an organization. And then again, that is different from the type of system that we use to track instruments, which is an asset management system. Both of these systems are useful and important, and a big facility could not get by without it. Financial systems are essential in managing the financial activities of the organization, and these include accounts payable systems, charge description master systems, which are used to manage a listing of services and items that are chargeable to patients, billing, payroll, decision support systems. Then there's public relations systems, like the hospital's website, social media, Facebook, Twitter, etc. Okay, I want to focus on tracking systems because these are the tools that you're most likely to be using in your day-to-day. You could have a system that is a turnkey system, which was just brought into the hospital, set up quickly, and then you learn how to use it, and there's little support afterward. There are systems that can store for retrieval count sheets, just a count sheet system. Then there are systems which can track instrument sets, all kinds of instrument sets and instruments to any place that they're scanned to. So the human portion is picking up that scanner and scanning that barcode. However, there are also RFID tags that can be used, which can track in real time. This involves the use of a sensor like they have at like the grocery store or Walmart, where you're walking past the sensor and the alarm goes off because they forgot to disarm the RFID chip inside of the item. Tracking systems available for CS can forecast the needs and identify processing costs for trays and single instruments. There are manual methods that use handwritten tags, logbooks, wall-mounted bulletin boards, etc. to track equipment, but they're being replaced slowly but surely across the nation, and probably Canada too, with computer alternatives. And cloud computing. This is what we're doing right now. I'm recording a video that I'm going to upload to the internet, to YouTube, and then this video can be accessed from anywhere. This is essentially what cloud computing is. So if you have a tracking system like SensaTrack, I'll use them as an example. Their servers are in Tennessee, so all of our count sheets and all of our information regarding location, last place scanned to, count sheets, everything, it was all stored on the servers that belong to that company. That's cloud computing. Okay, takeaway from page 423 is turnkey system, cloud computing, RFID tags. Tracking systems meet specific needs. So I don't know how big of the facility is that you're going to be in, but if it's a very small facility and they don't need count sheet management systems or tracking systems, you could be doing just manual. This is still a tracking system. You're using a paper log in a binder or on a clipboard to be able to track the movement throughout the facility of patient care equipment and instrument sets. But there's a really good possibility you'll be using a computer tracking system. And these computerized systems in use, the integrity of the data is consistently more reliable than with a manual system. Computerized standards are accepted by HIMSS, which is the Healthcare Information Management Systems Society, and are used by applicable facility departments to securely store backup data. So yes, there is a standard for securing data used in sterile processing, tracking trays, etc. Tracking systems by nature have to be continually updated. So every time I pick up the wand and scan an instrument set into a location, that's an update to the system. Sometimes there's software upgrades needed, but you can go into some kind of a system and update a preference card. So that's an update. All right. We got the RFID tags, which can locate things in real time. I was at a conference and I saw this system where they had put an RFID tag on absolutely every instrument in the set, and then another one identifying the set itself. They set it on this sensor table, and I thought this was excellent. You look at the computer screen with the set sitting on it, and it populates a list of everything that's in the instrument set. They took an instrument out, they passed it over here as if it was being passed to the surgeon, and it showed up as missing from the set. So this is where we're at now. I don't know how many facilities have gotten on to that system. However, it is a huge step in evolution simply by adding the RFID tag to the instruments. They're pretty small tags. So what is the value of tracking at the instrument level? Well, in the case of that RFID tag system where the sensor in the operating room can tell you if there's an instrument not in the set, this is a great value. We can really decrease the number of instances where instruments are left inside of a patient at the end of a surgery, which is, believe it or not, still an issue. But for CJD, which we're all familiar with, this is a prion disease. Prions cannot be destroyed in routine sterilization methods, so if we were to lose instruments that were used on a prion-infected brain, this could be very bad, with the ability to locate every instrument that was in a set at the time it was used to see where it's migrated to, because instruments do migrate between sets. We don't like that, but it is something that happens. So you could run a report and find every one of those instruments and where it currently is. Basic tracking systems can account for complete instrument sets and trays, specific equipment items, like where are all of our feeding tube pumps, the last known location of a specific instrument set, tray, or equipment, provided that the tech scanned the barcode, the cost and value of specific equipment and instruments, and the total cost of an instrument set or tray, the number of complete processing and use cycles through which instruments and instrument sets have moved. That's a valuable information to have. You can determine something like, after so many times through the sterilizer, it's time to send that set out for refurbishing or maintenance. And preventative maintenance schedules and repairs made to specific equipment and instrument sets or trays. And even productivity reporting information. This information can be used for educational and training purposes. So you can run a report and say, let me see what happened on this shift at this time, maybe even with this individual tech. The tech was assigned to do instrument sets and nothing but instrument sets. It looks like this tech's numbers are low. So yes, they can track productivity using a tracking system. Okay, please don't forget to review this chapter beyond this video and be prepared for a quiz and ultimately a final examination. Okay, y'all, see you soon.